body, I don't understand when the people build the building and pay for it, that it doesn't belong to the people. You're saying that a surplus building, any government building, whether it be federal, provincial, a school board, yet you're telling us that a hospital building does not apply under the surplus regulations of the province. Can you elaborate on that?
All I can tell you is that hospitals are incorporated as nonprofit corporations and fall under the Public Hospitals Act, and it's different than, I'm not familiar with the legislation for schools, but I do know that there is not that requirement.
Okay, and the value of that building, it's been rumored somewhere about 86 million. I don't know if you want to share it with us, and it's for sale for 2 million. So a lot of the public are crying, what's going on there?
So
If you can elaborate.
I will, what I can say is that the property has had a valuation. I don't believe that it will be a good business move to share
You
that
should.
publicly,
Right.
but I wish it was valued at 86 million.
Now long-term care bed. I did some history here, and I understand there's a 10-year waiting period, and that there's up to 200 people to get in the St. Josephville, and that they only get in through normal attrition when somebody passes away. Do you want to elaborate? Is that number false?
I don't know their waiting list, quite honestly.
Right.
And as I said, I don't think any of us are debating the need for services for
Right.
seniors.
And do you have any room behind the new hospital? Is there actual land? If we had to build a long-term care facility there, is there actual land near the helicopter pad or near
Actually-
all the parking there?
Actually, I don't think there would be sufficient land, to be quite honest, and I say that because I am familiar with the design standards
Right.
and how you need to develop. The other reason I say that is that when we developed the site as it's currently being constructed, we needed to have a master program approved by the Ministry of Health and Long-Term Care. And that master plan had to project our future beyond what you and I will be here for.
Right.
But that's where the commitment for the site will be used. So we have, right now we have a new front, as you know, but we also have a tower that is of a different vintage, and the Janet Mackie now yet with different dates. So we had to develop a master plan for 20 years out and answer the question, so what do we do next in 20 years, and how would we redevelop, how would we expand, et cetera. And that's where we use that property. And there's actually not a lot of property there. Our boiler, our infrastructure sits in behind as well, almost right to Guy Street.
Well, I appreciate the report, and I appreciate Councilor Terry, your board is doing. But I have parents. I have a mother that's 86, I have an aunt that's 90, and I have another one, 92, and they're all living on their own. If they fall and they have to be in a wheelchair, we need room for these seniors. We look around this room, there's a lot of gray hair there, and the need is there. Is there any plans, being you're the hospital board, to provide a plan to this council?
Well, and I guess that was very much a part of my presentation. We're not seen with that mandate by the ministry. So I think that if we're going to talk about a plan for long-term care, it needs to be a community initiative. But our responsibility and the only mandate we have is for acute care, rehab, and community
I
mental health.
appreciate that. So you'll take that $2 million when it's sold and divert that for long-term care? Will that be considered? I hope so.
Let's get
Thank
the
you.
check.
Thank you.